No surprise, opponents of the Senate GOP health care bill have been loud and unwavering. But what do doctors think? For all the criticism, there are physicians who support the plan. I spoke to a group of doctors, all who voted for President Trump, and they shared with me some surprising insights and diverse viewpoints. And not all of them are Republicans. By show of hands, take us back 9 years. Who thinks that Obamacare made health care better for patients? No one. When you look at the new Senate health care bill that's proposed, do you believe it is better than the Affordable Health Care Act for patients?
I think if we could actually come up with a robust bipartisan plan, a compromise perhaps, not
Without
necessarily the repeal and replace, somewhere doctors and patients stopped having a relationship, and that happened under the Affordable Care Act.
Dr. Coca, you didn't raise your hand.
Not. If it passes, the success will be determined, just like the success will be determined with the ACA. How much are average Americans paying out of pocket for their health care?
When you think about all of the people who are on Medicaid, it's children, it's 64% of people who live in nursing homes, and they're scared. They're scared when they look at these numbers that they're going to lose this protection.
Here's a problem. We in this country focus so much on treatment of disease. We need to shift the focus to prevention, and you do prevention by developing a doctor-patient relationship, as Nicole just alluded to. You cannot develop a doctor-patient relationship when I have the government in my exam room.
Medicaid supposedly was to give people insurance so that they could stay out of the emergency room and get a relationship with a doctor on the outside. But that hasn't worked out because doctors don't take Medicaid.
A lot of the hype right now about the Medicaid cuts, I think people don't understand that these are not cuts in existing benefits. These are cuts in the progression and the increase in Medicaid spending.
Show of hands, who agrees that this new Senate bill is most beneficial or more beneficial to the average hardworking American?
Oh, definitely.
Who agrees that this new Senate bill is most beneficial to poor Americans?
Ultimately.
My goal is I want to give people choice. I think that part of what has happened under the Affordable Care Act is we've taken away choice.
Simply giving health insurance out, right, does not equate to coverage. So why is it?
The responsibility on patients by giving them robust HSA funds. Patients right now have no idea what healthcare costs. They don't even care because they don't know. They have their insurance card, they pay their premium, and that's it.
Then what will drive those costs down?
Limiting the cost of pharmaceuticals, allowing competition of insurance companies across state lines, allowing Medicare to negotiate drug prices, all the things that are common sense that no one in Congress, whether they wear a blue T-shirt or a red T-shirt, has the courage to stand up and say this is what needs to be done for Americans.
If we mandated total price transparency, where an individual could not be charged based on the insurance they had, but rather on the service that was delivered. For example, if you went to a grocery store and you asked, what is the cost of a price of a dozen eggs? And the clerk said to you, well, what credit card are you going to use? Otherwise, I don't know. That's our current healthcare system.
Really quick, across the board. Is this bill for all patients better than Obamacare? Yes.
Absolutely.
It's an attempt to be better than.
Yes. Yes.
We'll see with time.
If it's an attempt to be better, is there a safety net? We can all say here, I love the idea of free markets, but if free markets fail, many of us here could say, well, I can protect my family. For those who can't, if this experiment doesn't work, where's the safety net?
The safety net lies within the states. The states will have more liability to cover these uninsured patients, and what we'll possibly will see are increase in state taxes.
If you were to sit down with Mitch McConnell and say, Leader McConnell, here is what you need to do to get this thing through, speaking as a doctor, what would you tell him right now?
How about letting other groups form, not just employer-based? So if a group like the NRA or, I don't know, some other group, or a township. How about a township?
How about the NRA create health care?
No. How about, I'm just thinking of any
I'm
group
going to go
of
with
people.
a no.
Okay. Or a township. How about a township? You buy into your township plan, and then you have 50,000 people that are all buying into the same health care plan, or any kind of group of people. Churches, let them form a health plan.
The Hippocratic Oath says, first, do no harm. And when I look at some of the medical associations, American Medical Association, American Diabetes Association, American Cancer Society, AARP, have all come out and said this new bill is bad for patients. What am I missing?
So first of all, the AMA does not represent doctors. That's unfortunately one of the things that gets most of us angry, is that the AMA comes out and makes statements on our behalf.
The president has said healthcare. Who knew how complicated it was? And clearly, more and more people are learning how complicated it is.
My daughter is a high-risk patient. My daughter is 16 years old. When she was 4, she was diagnosed with type 1 diabetes. So I live this not only as a physician, but as a father and as a dad.
Is this bill better for your daughter?
I think it is, in that it allows choice, it allows more freedom. It doesn't say you have to go to this endocrinologist because your old one that you've been with for 15 years is not in the same system.
If you made $20,000, would this bill be better for your daughter?
I still think it would be better for my daughter. I think it, again, allows that opportunity to put the money in the health savings account, you know, make some choices, make some choices as to how I go and where I go.
Here's what was interesting to me. Across the board, people kept saying, well, the new bill doesn't have what we want in there, but there's the possibility. It's a possibility, and the door is open, but the door could close.
I'm going to be very quick on this. It's very good to use the words like choice and freedom. It's very easy. It's very hard to explain to a family of 4 that makes $26,000 that their health premiums are going to go up to $6,000, to an elderly person who's 64 who has a condition that their premiums are going to go up 300%. Choice and freedom are one thing. The reality of the numbers on the bill do not support what was being said in that meeting that you had.
Choice is okay if you have the money to afford the choice. Steph, they can explain.
You live below the poverty line. Choice isn't a word in your vocabulary.
You cannot explain away that this is an attack on the poor. It's an attack on the elderly. It's an attack on Planned Parenthood. It's an attack on Medicaid. This is a bill you wouldn't poke with a stick.
All right, then, we're going to leave it there.